we're going to go ahead and get started here, and I'm going to tell you a little bit more about American Business Systems and who we are here at American Business Systems. We are and have been for going on now 20 years, helping folks just like you're seeing here on screen, just like yourselves, working from home, want to work from home, or in some cases be able to work from an office. So this is what we do, and we've been, again, doing this for, like I said, 20 years here. If you have not yet been out to our website, we want to welcome you and join us here on our website at American Business Systems. And it's absystems.com, as you can kind of see right up here at the top here. You're going to want to get into our website there, because you'll see on our website that there's a section certainly about us where you can see all about us, and also some of the doctors that are actually part of our business here as advisors on there as well. We just got some of those listed up there. But really where I want to draw your attention to is right here in these big orange buttons here. This will allow you to get into our next section, which is called our virtual brochure. And as you can see here on this particular screen, we've got areas that you can get into our opportunity, the getting clients section, the training section here. And folks, you can take as much time as you want to go in through here. And there is a lot of information there, not only the things you can read, but also some things that you can watch. And then really more importantly, there's some folks that you can actually speak to, some of the licensees that have been with American Business Systems for quite some time. So please go out there to our virtual brochure and check us out there. A lot of people ask us about the Better Business Bureau. We've been a part of the Better Business Bureau for quite some time and have an A+ rating here, as you can see here on the screen. And then also, if you want to come and visit us, we've had a lot of requests for people to come ask us to come to our office here. And we're at 5751 Kroger Drive. We are in a community just north of Fort Worth. We'd like to have you come on out and visit with us and spend as much time and take the time to ask us questions, see our office, and see our operation. We'd love for you to come on by. Our next training is coming up here very, very quickly, October the 28th through November the 1st here, as you can see here on the screen. Now, folks, you can see here that this is the last 4 days of October, the first day of November, which is that Friday afternoon. So we will make sure that you get a full week of training there, so there's nothing broken down. Now, this is only one of two that are left here for the rest of the year. So you're going to want to get into one of these training workshops here at the close of 2013. Let me introduce to you our founder and CEO of our company, Patrick Phillips. As you can see here on the screen, Patrick is an author, has written several books. One, How to Reprogram Yourself for Success. He co-authored several with several other authors, Wake Up, Live the Life You Love. And the one on the right-hand side is one that we've written, or he's written, more importantly for you as a licensee to help you in your marketing portion of your business, called Cash Crunch to Cash Flow. And if you've got any questions today about our marketing, about the book, about Patrick, about American Business Systems, more importantly, maybe even about Obamacare, today is the day for you to ask us those questions. So without further ado, I'm going to bring Patrick on. Patrick, let's have you up on the screen as well. It's going to be fun here to be right here having you on video with us here this afternoon. So here we go. All right, you're muted. Patrick, I believe you're muted if you can hear me.
I didn't push all the buttons I should have pushed, huh?
There you go. There you go.
All right. Well, thanks, guys, for being on here today. Hey, we thought we'd just do something unique. This is kind of a live questions and answers. We've already got some questions that have been emailed in to us, some frequently asked questions that we're going to be fielding today. And then Eric is going to kind of be monitoring the little question box over there. Eric, you want to kind of tell them how to type in their questions there in case they haven't figured that out?
Yeah, folks, if you look up in the right-hand corner of your screen again, that's where the Go-To Webinar Control Panel is. And you saw where there's that little icon of a hand, but there's also an icon of a question mark. And this is really for you today. So make sure that if you've got a question about medical billing, the medical billing field, Obamacare, we don't care what it is today. this is your turn to ask questions. Now, we did get, as Patrick had mentioned, there are a lot of questions that we've already gotten in that Patrick and another special guest that we're going to bring on here in just a moment. So, Patrick, I'm going to turn that over to you, and I'm going to kind of monitor these questions as they start coming in.
Good. Yeah. We want to kind of put a priority on the questions that are live being typed in today, but we do have some, like we said, that we've heard from some other people. So I'm going to introduce one of our business coaches here at ABS, Dirk Davis. Dirk, are you still with us there? You'll probably have to turn on your camera. There he is. Hey.
I am, absolutely. Good afternoon.
Good, good. As you can see, Dirk is working out of his home, just like I am, and just like Eric is. We are a virtual company to some extent, although we do have a large office building that I think you showed that picture earlier, Eric, here in Keller, where our staff is. But sometimes we just work out of our homes for these webinars. It's a lot quieter to do that here. So let's get started by asking Dirk to just go ahead and read one of the questions that have already come into us, Dirk.
Well, absolutely, and there are quite a few of them. We do appreciate everybody for sending in these questions. As Eric mentioned, this is absolutely a week where you guys have control of the webinar and you dictate what we talk about. So I haven't had a chance to go through and put these in any sort of order, and I'll try to prevent any overlap. But the first one, which is a very popular one, Patrick, how, as a licensee, how can I know how many other ABS licensees are in my area?
You can always find that out directly from your ABS rep. We want you to know that we keep careful content as to what's going on out there in the field with our licensees, and if there are licensees that are actively marketing in your area. Remember, some licensees get started in this business. They get a doctor or two or three, and they're making the same kind of income they were making working for somebody else, and they stop marketing. So your competition from our licensees ends at that point. And the other thing is, since we don't have territories, your territory is really the whole United States. And that means you can sign up doctors anywhere in the entire United States. We have licensees who've actually got clients all over the United States, because if you sign up a doctor locally, for example, and that doctor knows another doctor, say in another state, and they refer that doctor to you, you can do the billing for that doctor too. So it kind of opens it up and nullifies the question of, well, how many, if you had a Subway sandwich shop, you'd be concerned if there was one on every other block, right? But with us, there's no territory, so it doesn't really matter that much.
Yep. Great way to grow a business for sure.
Yeah.
Okay, here's an email from Sherry. It says, what is your licensee fee and what does it include?
Well, back to our website that's showing here on the screen, that's a good question. It's under business packages, where you can actually find the investment. Our investment is a set fee, what's called a license fee. It's kind of like a franchise fee for a franchise of $24,990. In other words, $25,000, basically rounded up. That includes everything that you see there under that link there on the website. So I'm encouraging everybody to go to the website and look underneath that business packages for everything that's included, and you'll see there's a lot.
Yep, absolutely. Well, and kind of tied to that, here's an email from Glenda. It says, are there any other costs outside of my ABS licensee fees, such as clearinghouse fees, support, software upgrades, etc.?
Yeah, Eric, why don't you address that question?
Okay, absolutely. Folks, what we'd like to do is first of all, there is the $24,990 price that we have here, and that does cover all of the services that you see there. But folks, there are operating costs that kind of go along with it. But what is beautiful with our system, our iClaim EMR system, is that our system is all 100% integrated. So you do not have to pay for an outside clearinghouse. Now, Dirk and Patrick, we all know that the cost of those clearinghouses can be a little pricey at times. But more importantly, guys, I think what's so great about us having our own clearinghouse is the fact that we get to deal with real-time claims. Unlike whenever you're using a third-party billing platform and then a third-party a clearinghouse, where it takes a little bit of time for that communication to go back and forth. So to that particular question there, that's a great question. But again, you get to eliminate that completely with our business package.
Well,
Yeah.
and to follow up with what you're talking about there with the clearinghouse fees, Eric, also, the fact that it is a real-time transaction, it of course helps lessen the amount of time that it takes the doctor to receive the reimbursement back. And of course, that goes to the biggest issue facing our country's physicians, is that of their cash flow. It's never been tighter, and it's never taken them longer to get the reimbursement. So, extremely critical.
Yeah, I think a lot of people ask those kinds of questions about ongoing fees because they have heard from other people who are, in this business, in this industry. They'll hear that there's ongoing new user fees for each additional user that uses the system. There's upgrade fees for the software when it's upgraded. It just goes on and on where they ding you left and right. We don't do that. That's all a part of your lifetime licensing fee there with us, so that we don't have to charge you anything on the back end. There's no ongoing fees to access our licensee website. There's no ongoing fees for support. Folks, that's a one-time fee. And that's because we built the business based on us making a few pennies on each one of the transactions that are happening behind the scenes from our clearinghouse.
Patrick, there's a question that came in that I think it can segues right into what we're talking about. And this is from David. David asked, so what's the difference between, or the differentialities between American Business Systems from other billing product companies, such like Healthcare Practice Partners, Care Cloud, and even CleanTech?
Well, that's a great question. There's several things that distinguish us in the marketplace from any other companies out there. First of all, you can't compare us with other cloud-based or server-based software systems because we're not selling software. We do have an excellent leading-edge technology that allows our licensees to get the money in for the doctors as they should as a billing company. But you have to consider the fact that we, as a training and support company, are really helping you with, number one, how to get the clients. Our week-long training here, for example, is pretty unique in this industry. I don't know of any other company that has a live training workshop for a full week here in Dallas, where you fly in and you actually sit in the class with other people who are looking at getting into the business, and of course with licensees that I fly in to actually do the training. That's pretty unique. Our lifetime support is fairly unique. Having access to our licensee forum and our website, where you can download all the webinars that have been recorded over the past 20 years. There's a lot of data that you're getting from us that you just won't get from anybody else.
No doubt about it. Eric, did you have any other questions? You want me to go back to some?
No, why don't you go ahead with some of your questions? There's some that I'll probably interject in here whenever we get to a particular topic, but let's keep going with some of yours that you have.
Well, okay. Here's one that says, do I need prior experience or training in medical billing and or coding, and do I need to be certified to do this?
Eric, why don't you feel that one?
Okay, absolutely. Matter of fact, Adam Phillips, the president of American Business Systems, he and what was it, Patrick, about 3 or 4 weeks ago, we actually did a webinar on why you do not need experience in with American Business Systems. And let me explain the reason behind that. Folks, when you become a licensee of American Business Systems, you automatically gain the 20 years of experience here of American Business Systems. Not only that, the training, and like Patrick has said, the support, the ongoing support, and I think, Patrick, a lot of people will ask about the codes and even about putting together a proposal. How do I even know how to properly price myself properly? So, folks, these are the things that you gain from us immediately. Patrick, why don't you tell them a little bit about one of our licensees that just recently came through training, Dr. James Thomas. I think he had actually got a client before training, and here's a guy that didn't, he's a PhD in IT, so he's not a medical doctor, so he didn't have any medical background here. He had just a complete IT background. So why don't you kind of share with everybody about because this goes right along with that experience portion of it, about how we were able to jump in there and be his experience immediately.
Yeah, when we take a survey there in the classes of to how many people here have some kind of background in the medical field, very few do. I mean, out of a class of 10 people, there might be 1 or 2 at the most that have had any even worked in a doctor's office, didn't do the billing. They just maybe had some connection to the billing, the medical field. This Dr. Thomas, of course, like you said, he's a PhD. He's not a medical doctor, but to show, I kind of categorize him, and I don't think he would mind me telling you this. He is more of a nerd than he is anything else. He's not a business guy. He hadn't been in business, but with our help and our hand-holding, even prior to him coming to our workshop, because once you sign up as a licensee, guys, you are a licensee, even if it's a month before our training workshop. So we worked with him, showed him how to do the practice analysis with this particular doctor that he had run across that wanted to know more information. We did the proposal, helped him put together the proposal for that doctor, went through all the contract negotiations and signing with the doctor, and had the doctor really signed up and ready to go on the electronic medical record system that we have available. And he was going to do their billing, of course, all before he showed up. And Eric, you remember, I don't know if you were in the room at the time, but I remember being up front saying something about something. And he said, well, should I do that with my doctor? And I said, you mean your own personal doctor? He said, no, the doctor that I signed up. I said, you mean you've signed up a doctor before you got here this week? And he said, yes. And I said, well, I guess my support people are doing a good job.
Yeah.
Well, that goes along with it. And I want to add one more thing for the folks that are on here that are thinking about becoming a licensee, and really to Dirk's question is why do we not need any experience? And again, Patrick and even Dirk, why don't y'all explain a little bit how we do the demos? I mean, because I think it's the demos that are really what's helping those licensees who really don't know a lot about medical billing and how we bridge that gap.
Dirk, why don't you feel that one?
Well, yeah, absolutely. We continue to talk about unique aspects of our opportunity here, and that's one of the things. And this all falls under our unlimited lifetime support that comes standard with our business package. As you are working with these potential doctors and conducting your practice analysis and things along those lines, when the doctor and their staff want to see our iClaim system, our medical billing platform, let us know. We will schedule the demonstration from our end, have the folks from our end actually perform the demonstration on your behalf for the doctor, their staff, answering any and all questions and helping them to see exactly, the bells and whistles, how it actually works. And I'll tell you, from having been on dozens of those things, if not hundreds, it takes about 4 minutes into one of those demonstrations before the doctor is sitting there with their jaw on the table. I mean, they just the way that doctors have been conducting their business is light years behind the way that we're able to enable them to do their business. So it doesn't take long at all, but it is something else that makes us unique. It shows that we're right there alongside our licensees every step of the way, albeit virtually, but having experts on the phone right there with you when you're prospecting to your clients, it's invaluable.
Yeah, and that's all a part of being an ABS licensee. There's no extra cost for that. So we literally get online, show you and the doctor at the same time using this kind of technology exactly what our system is all about and how by utilizing our system, you as a medical biller can help that doctor get more money in. That's the bottom line.
Absolutely. Well, it's funny. I'll skip ahead here. I see that Jason emailed in, and we talk about Dr. Thomas. That's absolutely not the typical scenario. But Patrick, I've got a question here about how long does it take to receive the return on your investment?
Oh, return on investment. Boy, that's an important aspect of any business. When I invest in this business, my startup cost, how quickly can I get a return on that investment? And folks, that's going to vary, of course, depending on you as an individual. Everybody does this differently and spends a different amount of time on the business. Some are part-time, some are full-time at the business. Some have people helping them with the business and some don't. That all depends on your efforts, of course, that you put into the thing as to how quickly it gets going. Now, we've had people say that they've got a return on investment in the first 6 months. We've had others that's taken a year. But folks, in today's world, any business that's what I call a real business, that's not some kind of fad or something that's going to be around, that's built on a solid need in the marketplace, that is amazing that you can get a return on your investment in any business within a year. Most businesses don't show, in the black. They don't go from the red to the black ink until, a year or more. So again, I hate to be too specific about that because it will vary depending on the effort that you put in.
Well, but you're right. I saw something the other day again that something like 50% of all new businesses fail within the first 4 years. Well, if we're providing a way to get a return on your investment in 6 to 12 months, I mean, of course, when you're investing your hard-earned dollars, that's certainly something to that plays a big part in the decision making.
Absolutely.
And folks, don't forget, I of course am again reading some of these emails that had previously been sent in. But for any of you folks that are on the call, feel free to type a question there into the control box on the right. Eric is monitoring those. Eric, do you have any more there?
I do. Thanks for letting me get here. Partha is asking a question, and I'm going to kind of tie that in, Patrick, to how do you get to return on your investment? And he says, I'd like to understand in detail about how to replace $100,000 income.
Well, you mean this person is asking how I can teach them to replace specifically their $100,000?
Well, because it says, and he goes on to say, he says, I did see on your website, but can you explain in detail? That portion underneath there where you kind of got right there on the screen where it talks about income potential. Let's explain a little bit more detail how many doctors that you're going to have as a client to get to that, whatever that magic point is for anybody. Whether it's 100,000, to some it could be replacing a yearly income of 50,000. So that's what he's asking here is
okay.
How many doctors do I need? How does that income potential work on your website there? So let's kind of go to that and let's kind of explain that a little bit more in detail.
All right. So Eric is referring to a tool that we actually have on our website here. Again, this is absystems.com, and I'm going to show it to you here right under income potential. There is a medical billing income calculator that we have on there. Now, we designed this, folks, so that you can plug in your own numbers. You'll notice there's already some numbers in there. Let me zoom in on that. I know that's kind of tiny. And for example, it's got a 1 in there for the number of doctors that you would like to have as clients. Now, I hope you want to have more than one client, but we had to start somewhere. And then it asks for the number of average number of patients that doctor sees each day. This will vary from the type of doctor. If it's a specialist, he may not see but 5 a day, and if he's a general practitioner, it might be 40 a day. So we again just have a 20 number in there. I'm going to leave those numbers. And then the average number of days that the office is open per week. Some doctors are open only 4 days. We have 5 in there. And then it asks you the charge. Now, folks, we've put a low number in here. We wanted to kind of lowball this because we didn't want to over-exaggerate the income that can be made. But honestly, our licensees are charging up to 8 or 9% in many cases of the doctor's revenue that's collected. So if the average claim is around $100 for a doctor, and that's probably low too for most general practitioners. But based on these numbers, let's hit the submit button here and you'll see what it comes up with here. Now remember, this is just for one doctor, and it says that your gross income from this doctor would be around $31,000 a year. So all you have to do, I ask people, look, tell me how much money you want to make, and I can tell you basically based on what numbers we know are average for our licensees, how many doctors you'll need. So for a 6-figure income here, it looks like you need about 4 doctors at these numbers here. 4 doctors is not a lot, folks. It's a handful of doctors. We have licensees who have over 200 doctors. So, it depends on what your goals are financially.
Well, in this scenario as well, to do the billing for those 4 doctors, in most cases is going to have the licensee working fewer hours than they would be working right now at a traditional job. And if they choose to do it from home, they don't have the commute time or anything like that. So again,
good point.
It doesn't take much. It doesn't take many doctors to make a very good income.
Yeah, because this is saying that they are seeing 20 patients a day. That's only 100 a week, right?
Right. Yep.
That's 400 a month, 400 claims. Folks, that wouldn't take you even a part-time. I mean, right. A very part-time. Yeah. maybe 5 hours a week to do those 100 claims.
Right.
Yeah, that would
Not
be
long at all.
No.
Next question here from Sylvia. As a licensee, how do I get paid? Does ABS pay me or does the doctor pay me?
Eric, you want to handle that one?
Sure. Yeah. How you get paid? I mean, certainly that's why you're getting into the business is to get paid. You do not get paid from American Business Systems, so we'll start there first. So let's talk about how you do get paid. Since you will be an independent medical billing company, you will be contracted directly with the doctor, and then with the doctor, once he or she you start to help them get their reimbursements in, then you will at that point invoice the doctor for what they've got reimbursed. So again, based upon the numbers that Patrick is showing here, and again, that average claim amount of $100 is pretty much average of what those reimbursements are going to be. I mean, and they could be all over the map, but pretty much about $100. It could be a little bit more than that, but on average, that's going to be the reimbursement amount. And so whether you're invoicing that doctor every 2 weeks or once a month, that's what you're going to be doing. And then within our system, in the iClaim system, there are reports that you can run automatically every month to pull out those numbers of what's been reimbursed to the doctor, and then you'll just send an invoice to the doctor and then get paid. Now, I will say this, Patrick, with that question being asked, a lot of people want to ask, well, what about, will the doctor pay me? I know that we've had a lot of people really ask about how can I guarantee that the doctor's going to pay me? So you want to kind of address that one a little bit?
Well, it's very simple. We teach our licensees that since they're in the revenue cycle management business, that they need to manage their revenue cycle as well. So the contracts that we have already made up for you guys that we've had looked at by our legal folks, we suggest that you use these contracts. They actually have in there a clause that says that the doctor will allow you to debit their checking account once they've verified, of course, the numbers each month for the billing. That's a real simple thing to do because you can give the doctor access to our system live from any internet connected device, and they can actually verify that your numbers are correct. And once they've done that a month or two, it's like a no-brainer because they've already been paid right by the time you bill them. And so you just debit their account for that amount of money that's 6 or 7 or 8% or whatever of the money that you collected for them. And it comes right out of their bank account. So there's no way they can't pay you. You have access to that.
Yeah, I mean, the one thing you could do, and I'll turn this back over to you, Dirk, here in just a second. But folks, you got to realize you're collecting money for the doctor. You're really holding the flow of that
money
cash.
Bag.
Yes, you're really holding that. So do you really not think the doctor's going to pay you once you're helping them get paid? That's really the approach of it. But certainly, the doctors will end up paying you because you're probably getting them paid more than they've ever gotten paid in the past as well.
Yeah.
Well, that's what I was about to say as well. That what the doctor's paying you is pennies compared to what he's been paying for those same services. So, especially if they've been doing their billing in house.
Yes, if they've been doing it in house, on average, folks, we can just about cut that in half. Whatever they're spending in house for their own staff, their time, the software, the hardware updates, and all kinds of things that are involved in managing that in house, we can just about cut that in half. So you're saving the money on one hand by outsourcing to you, and then you're bringing in a lot more money because of the way our system works. Yeah, it's a win-win there. You notice I changed the numbers here a little bit. I zoomed in there so you could see what I did there. 4 doctors, 30 patients a day, 4 days a week at 7% at an average claim of 150. So you can just play with this calculator any way you want to, folks, to come up with the numbers. And here's where you can make your 6-figure income right here.
Exactly.
Not only 6 figures, but that's top 5% wage earners in the country right there.
Exactly.
Oh,
Why
yeah.
don't you put those numbers in? Go back to that because we just recently had a licensee that has one client, which is a sleep doctor. So let's put in one, and you said that they are averaging 120 claims a month. So leave that there, and then they're open 5 days a week. And then you say that she's charging 5% about.
It was 5.5. Yeah.
900 and what?
It's about $950 per claim because it's a physical therapist.
This is a sleep clinic. So let's see what kind of revenue she's generating.
Yeah, that's about right. She said it would be about 30,000 a month for her.
And folks seeing that on the screen, don't forget, with all of, as Eric mentioned earlier, all of our services are web-based, so you can be earning that money and processing claims for that one sleep center on the beach of your choice. So that's not a bad way to make a living right there.
Yeah.
Fulfilling about 30 claims a week.
Yeah.
That's not too bad. That may be a busy lunch hour, but not a bad week. Next question here. How do the doctors react to the fact that I will be operating my business from home or the beach?
Well, first of all, the doctor never needs to know that you're working from home. Even if they did, folks, in today's world, that's kind of a given thing, right? I mean, there's lots and lots of home-based businesses. Doesn't matter where you're working. What matters is, does the doctor have trust in you to collect his revenue? And we teach you to position yourself as a part of the nation's largest network of independent medical billing companies. That's us. I mean, you can speak in terms of us because you're a part of us as a network. So you can say, we do thousands of claims a day for hundreds of doctors from coast to coast. And it's true. And you can position yourself the right way. We also teach you how not to use your home address on any of your marketing materials, and to get other addresses set up to make it look like you really are an established business in your community. The doctors don't come to your home. You go to them.
Yep. Here's a question. This kind of goes along with something we were talking about a few minutes ago, but he asked, are doctors already doing their own billing? And we touched on that, and that's one of the questions that we as consultants here get asked quite a bit, is who's your biggest competition? And that is it. It's the doctor's own in-house billing system. And as Patrick alluded to a while ago, from just a dollars and cents perspective, it's not even close. But then when you actually get into the the meat and potatoes of our systems and our services, it is, again, light years ahead of what these guys have been using for their in-house methods. And it just makes for a very easy conversation for them, or between you as the licensee and the physician.
Exactly.
Who are the best prospects for this business?
We get asked that a lot, and of course, that's proprietary information. I would be able to share that today with everybody, but then would have to kill you. So I can't tell you that. No, we do have some specialties that are out there that we recommend that are very high dollar. Some of them are low volume claims, but high dollar, like the one we just showed you there from a physical therapist that could be $900 a claim. There are surgeons who have claims that are 10,000 plus claims. So it just depends, but there are some real specialties out there. Let me see if I have that list here. Hold on just a second. Oh, I had that list somewhere here, and I can't put my hands on it, but we have a whole list of the specialties. Guys, you saw the list earlier when I tried to go out to Google and it didn't work there for me. But all those different specialties that you saw listed there are a handful of them. I'd say, Eric, maybe 10 that we recommend during the training class, the real specialties that they should be looking at. And we'll go over that in detail, of course, in the training for you.
Yeah, it just goes to say that any physician or like what you just said, a sleep center could be a great potential client. I mean, anybody that serves the public and is in the medical field, and that they're using what's called the CMS 1500 form. That is the key term, if you want to say, that allow you to do the billing for these doctors. And so whether it's a surgeon or whether it is a cardiologist or a podiatrist or OBGYN doc, it could just be any. So really the field's pretty wide open there.
Yeah, I actually located that while you were speaking there, Eric, and I do have some of them here that are listed. Cardiologist, of course, endocrinologist, gastroenterologists. Can't even say some of these words. Geriatric medicine, infectious disease doctors, internal medicine, nephrology, neurology, orthopedics. Anyway, there's another dozen or so there, so it looks like about 2 dozen. Yeah. that we recommend that you go after there in your community.
Yeah, I guess maybe I should have reworded that and asked what prospects aren't, what doctors aren't, or what specialists aren't ideal for our business. We have a much shorter list. Eric, this may be a good question for you. I know as the director of our research and development department that you and your team have your fingers on the pulse of the day-to-day activities with our clients that are involved with us. What are my day-to-day activities?
Okay. Day-to-day activities. Well, first of all, is going to be receiving the information from the doctor, and that's going to be in some type of form. And if it's in paper form, it's going to be what's called an encounter form. This is nothing more than a sheet of paper that has the patient's name on it, and then those dreaded codes that everybody kind of worries about. They're called diagnosis codes and procedure codes, and those diagnosis codes are what's wrong with the patient. So like if I went into the doctor today and I've got a sore throat, well, there's a code for a sore throat there. And so the doctor would actually put that code down. And then the other code is the procedure code. Now the procedure code is what the doctor has done for me as the patient. So you as a billing company will take that sheet and basically data input from what that doctor has put into iClaim. So that's basically in a nutshell about what you'd be doing. Now there is some managing of that claim a little bit, making sure that it goes through properly, and then following up on anything that if anything kind of hits a little road bump there, but mainly that's basically what it is. Now on the other hand, if the doctor's using the EMRX, which is our electronic medical records platform, then that information is coming directly from there, directly into iClaim, and then again, you're still monitoring that, you're still processing that claim, but in that case, there's not a lot of data input. You are really monitoring, looking, checking, making sure that everything's going through properly, and then you're submitting that particular claim and that kind of going through there. Other than that, it's really customer service, making sure that that doctor is happy, making sure that that office is being taken care of, just like any client that you may have with any other type of business. So that's really in the nutshell. Now, certainly through that week of training, Dirk, that we certainly go through in much more detail of some of the more day in and day out things, but those are just some of the highlights there.
Sure, absolutely. Thank you for helping out with that. Here's a question from Ryan. It says, he says, every time I turn on the news, I see something else about Obamacare.
Oh, wow.
What effects are Obamacare having on the medical billing industry?
Well, Patrick, you knew that was going to come up here today, so.
Oh yeah. In fact, I found an article out on the web here that I'm trying to get to the slide where it talks about that. Let me show it here on the screen. This is from Bloomberg News. I guess it's just Bloomberg.com. You can find that out there. There it is. Doctors brace for health laws surge of ailing patients. So the best way to explain this is you've all heard these numbers, and I don't know what the real number is. It's 30 million, 47 million uninsured Americans. I don't know what the exact number is. It's a big bunch of people, right, that don't have health insurance. That means that they're not probably going and getting their healthcare needs taken care of like they should. When this takes effect next January, it's going to mean that there's a whole bunch of new people going to go start seeing the doctors. As you can see from this article here, this is talking about Holy Cross Hospital. It's a health center up in Aspen Hill, Maryland, and says that this is going to be it's going to be huge. Unprecedented access to care for a needy population, and it just means that there's going to be lots of doctors. Here's a quote from that article. Now I'm zooming in here. Says the increase in newly insured patients arrives at a time when the nation has 15,230 fewer primary care doctors than it needs. Yeah. So imagine this, folks. There's less doctors than we really need to handle all this. And then we got a new influx of doctors. So like this doctor, our vice president here of medical education at the American Academy of Family Physicians says, it's like we're handing out bus tickets and the bus is already full. The shortfall of primary care access is not an insignificant problem, and it's going to get worse. Now, the good news for us is, and for our licensees, is that as doctors are forced to see more patients, they're going to be pressed, of course, to be able to collect the money that they should be collecting for the billing for those patients. That means they're going to need your help. That's what that boils down to.
Okay.
I'm telling you, we're gonna have a boatload of people coming into the going to see doctors, and I like the way you put it, Patrick, with the you know, if the government had wanted to be in medical billing, they'd have done it a long time ago. Um, we've had a somewhat of a national health care already. You want to kind of explain how you explain that one a little bit?
Well, in 1965, when they introduced Medicare, of course, Medicare is a form of national health insurance. If you think about it, for everybody above the age of 65, right? So
Correct.
there's nothing new about the government getting involved in healthcare. And had they wanted to take over the billing or whatever, they would have done that back in 1965. Believe me, the government, that's the last thing they want to get involved in. They don't care who does the billing. It just has to be done by somebody. And the doctors should be having somebody outside their office do that because they're going to be seeing a lot more patients like this clinic here. 90,000 new patients are going to be coming into that system. And here's another quote. We anticipate an increase in primary care and specialty. And he says that down at the very bottom there, he says, an increase in business will be welcome. So the doctors are looking forward to the new influx of patients. But the point is, they're not going to have time to run their primary business, which is taking care of patients, and focus on the back end, the business side of their practice, which is collecting the money.
Right.
That's your job. Our
Absolutely.
So,
job.
Patrick, if I understand you correctly, really Obamacare, as we know it, really doesn't have anything to do of how billing's going to be done. It's just going to give us an increase of billing across the board.
That's right. Just more people seeing more doctors means more claims, and more claims means more work for us, for our licensees.
Exactly.
Yeah.
Yeah. Eric, do you have any other?
I do. I want to, Patrick. There's a couple of questions that have kind of come in dealing with, you know, monthly fees on those monthly fees there. And I know we've kind of gone into. There was one question here, and it looks like it has come in from Sherry. And Sherry's asking the question about how much of the monthly fees of that, let's say of that $30,000 that you showed a while ago, how much of the monthly fees are there that's actually taken out of that $30,000? And you want to kind of address that as well.
Yeah. Well, with any billing system, of course, there are some back end costs that you have to figure for folks because there are entities, what are called clearinghouses that Eric mentioned earlier, that's a part of our system, but usually those are third party companies that will want fees from you to cover each claim that goes through the clearinghouse, to cover their cost of reformatting the claim and scrubbing it clean and so forth. That's just a necessary evil of doing the billing. Every doctor who engages directly with the insurance companies have to pay the clearinghouse fees as well. With ABS licensees, you only have a set fee of using the system to process the claims for your clients. And there are unlimited claims, so you don't have to worry about a specific clearinghouse fee. But if we use a figure of most businesses, you're going to run somewhere around 40 to 50% of your gross will be on your back end costs. That's not true with our business. That's most other businesses. With ours, it's a very small portion of that gross because let's face it, most of it is your labor. And if you're the one that's actually doing the claims, you get to keep all that money. You can figure in general, folks, about 10% of the fees that you're collecting from the doctor that are going to be your back end costs. And those are set fees that you never have to pay another dime over and above those each month. So you know what your overhead is. And 10% of that, so take that out of the gross figures that we showed there, and the rest of that is your profit. Now, if you hire other people to do the work for you and do the claims, of course, now you've got some labor costs there as well. But you're not doing anything, right? You're just collecting the money and paying your people to do the work.
Yeah, because one of the things that we teach in class is how really that cost is covered by the doctor. So,
right.
What you want to do is, Sherry, is one of the things that we'll kind of discuss maybe even at a later webinar is basically how we show you to do what's called a practice analysis. Based upon the practice analysis, based upon any of your monthly fees, you add all of that in there, and then that's how you get your really your gross income on a monthly basis. And so we show you how to do that so that you stick as close to those numbers as possible. So again, that's one of the support mechanisms that we have here at American Business Systems. Now, kind of going hand in hand with that, Patrick, is that a question that came in here a little bit earlier about out of that money that is maybe paid in these fees, how much of that money is actually going back to American Business Systems, or their percentages that I got to pay American Business Systems on a monthly basis? Are there any like franchise fees that go along with here at American Business Systems?
No, that's the great thing about us being a business opportunity licensing situation, folks. You're licensing from us all of our systems for collecting money for doctors, but you're not having to pay us on an ongoing basis any kind of royalties or commissions. The way we make our money is we've made connections with the clearinghouses ourselves because of the volume of claims that we bring to our technology partners. And each month on the back end, they issue checks to ABS directly from them, not from you. So you never pay us another dime. But we are making money on those transactions, and that's a good thing, right? Because if we're making money and you're making money, of course, we want you to be that much more successful, and we're going to help you that much more to build your business as big as you want to build it.
We share our licensees' interests for sure. Folks, I see that we have about 10 minutes left. I can tell you I've got probably 28,000 more questions here. I'm not going to be able to get to them all. We do appreciate all the questions. Please contact your representative, your ABS representative, if we don't get your questions answered today. Email us, call us. That's exactly what we're here for, is to help you as you're conducting your due diligence. We want to help point you in the right direction. There are a lot of resources to help aid in your due diligence, and we'll help you kind of, like I said, direct you to the right source. So please email us or call us. Eric, do you have any other questions you want to try to get in real quick?
You go right ahead.
Okay.
Go on.
All right. Here's a question. I am not a salesperson. How do I convince doctors they need my services?
Well, that is the question, isn't it? That is the question. That's why we're in business. That's why we've been in business for 20 years. Because, folks, when my wife started doing medical billing back in 1987, there was nobody to teach us how to approach the doctors. So I did a lot of testing. I did a lot of trial and error, and spent a lot of money trying to find out, how do you get past the gatekeeper, if there is one there in the doctor's office. Now, sometimes the office manager is somebody that you want to engage with. We'll teach you how to know whether that's the person that should be involved in that decision-making process, or whether you need to bypass that person and get directly to the doctor. But that's what our entire training workshop is all about. Probably 50% of the week is spent on teaching our licensees exactly how to educate the doctors to the point where they want to do business with you. And so that's part of what we teach. Nobody likes to sell. There's nothing here to sell. You either have a solution to their pain or you don't. And by doing the practice analysis, as we teach our licensees to do, and then making the proposal, the professional proposal to that doctor's office, they're the ones who make the decision. There's no convincing here. They either save money by outsourcing to you, or they don't. They either bring in more money by allowing you to do their billing than they can do on their own, or they don't. So it's a very simple decision. And there's everybody that comes to the class that says they have a selling background, I warn them, you better just forget everything you know, because it doesn't apply to this business.
No, that's right. Unlearn what you knew.
Right.
And speaking of the training workshop, you see that we have mentioned there on the screen that our next training class is the week of October 28th. Folks, that's one of only 2 classes we have remaining between now and the end of the year. That's one of the reasons this far out we've already got it down to where there's only 7 seats available. Again, we limit these classes to no more than 20 folks. We like to keep it intimate, make sure that everyone gets their questions answered and asked and answered, and everybody gets that hands-on training while they're here, because there is a lot to learn. But let us know. Certainly, like I said, get with your representative if you have any interest in attending either this class or the last class, which is the week of December 9th. Would love to have you in there, and as I hope that you're seeing as you perform your due diligence, that there's no simpler notice I don't say easy, but there is no simpler way to get involved with an industry that has experienced double-digit growth even during this recession. And between now, this year, where we're scheduled to do healthcare is going to do about $2.2 trillion in total gross. In 6.5 years, 2020, that's going to almost double to $4 trillion. So for someone that really wants to own a business, be part of something, establish a legacy, I don't know of a better way to do it.
Yeah, this is the last of 2 classes, as Dirk said.
Yeah.
And as you can see, folks, people really packed in these last 2 classes of the year because they want to get up and running at the first of next year. So let me encourage you to get your due diligence done, research us, talk to other licensees, ask your ABS rep all the questions you want, and find out if we're for real and whether this business is for you. And then get your paperwork done so you can at least reserve your seats to get into this next class or the next one. The 7 seats, that's a real number, by the way, because we just had a meeting this morning where we talked about it, and potentially we do have the 13 seats already filled. So again, depending on the number of people who bring a partner or a spouse, those seats can go very, very quickly. So I would do your due diligence quickly.
Next question here. What are the liabilities in this business? Do I need business insurance or bonding?
Yeah,
Eric, you want to field that one?
Yeah. Well, first of all, there is always a liability because first of all, you're dealing with people's money, and so what I would say to you first of all is that you've got to look deep inside. Are you an ethical person yourself? That's the way I'd like to address that first. Then secondly, there are things that you receive from the doctor that are the doctor's responsibilities, and those are the codes. As long as you're not doing anything fraudulently in the financial area, like skimming money off from the doctor or anything else like that, there's not really anything that's a whole lot liable for you as the medical billing company, because you're only going to bill what the doctor gives you. Now, as that also, because you're dealing with the HIPAA compliance rules, you too need to be careful about how you're handling patient information. But in most times, again, those are some of those topics and discussions that we really deal with pretty intensely in the training class. But in general, this is a very good type business. I like what Patrick puts it, it's a very clean type business. There's not a lot of overhead. There's not a lot of inventory that you have because really you're just dealing with servicing the doctors.
Right.
So again, it's probably one of the safest type of businesses to actually be in. Patrick, you and I have both been in businesses before, and then Dirk has too. I mean, even with the businesses that he's had, we know what the liability is. We just know that anybody can sue anybody these days. We know that.
We tell people, look, it would be as if all you are is an external data entry clerk, right? You're doing the billing as if you were a staff member of the doctors in their own office. Those staff members don't ever worry about liability. Why? Because they're simply doing what the doctor told them to do. They're putting in the codes that the doctor gives to them. That's why our system double checks those codes, makes sure that they're right. But we tell our licensees, you can't change those. You're not a coder. You're not trained to do coding, so you don't do anything different from what the doctor tells you, and then you're fine. The liability is all on the doctor, not you.
Right. This question happens to jump out at me. I guess I've definitely got beaches on the brain, but it says, are you able to take time off for vacation? If so, how is this handled? It's been a while since I've been to the beach. I'm sorry.
Well, that's a great question, because if it's your own business and you're the only one doing the billing, what do you do? There are licensees, by the way, Dirk, who have taken their laptops with them on vacation and do that. Even some of the trainers, as you can see here in this picture on the screen, these ladies are actual licensees. They bring their laptop to the training that week and they're running their business. Now, they both have people who actually do most of the data entry for them back at their home states. But they do bring their laptops with them so they can manage the business from anywhere. It's not that hard to do. Now, if you really truly want to just turn everything off, you do have to have somebody that's doing your billing. So nice thing is that we are a nationwide network of medical billing companies, and we can arrange for that billing to be done while you're gone on vacation. And then, of course, you're splitting some of the fees that are received during that period of time with the people who are doing the billing, obviously. But hey, you are able to take off completely. And then, of course, with non-competes and things like that in place, you come back and those accounts are yours. They're obviously just doing the billing for you while you're gone. It's a cloud-based system, so they can do that from anywhere. Hey, I want to kind of wrap up here, guys. We just got a minute or so, and then I'm going to turn off the recording part of this at least. Here on the website, by the way, let me go back to our real website here so you can see it. A couple of orange buttons that I think Eric mentioned earlier. If you click on one of those two orange buttons, you will actually get to what we call our virtual brochure. And this is kind of a peek at it here. I've got it actually live running. This is exactly what you would see. You'll notice there's a welcome section. There's a whole section on the opportunity itself. And look at all the different pages that are included in just this one section. Then you've got the section on getting clients. And it has sections to it with videos, and there's a training section, a support section, technology. All of this has tons and tons of material, folks, that you will find very engaging. So be sure and click on one of those orange buttons. You'll be able to go through this yourself on your own and find out every detail you want to if you haven't done that already. Well, guys, thanks for being on here with me today. I thought this was pretty cool using the video for the first time here.
Absolutely, it's a great time, and Dirk, thank you. It's great to have you join us on the webinars, and you did a great job today. So thank you for being on here with us.